alaikum rahmatullah wa barakatuh. Hello, Journal Club listeners. Today's paper is a prospective clinical study that was published in the Australian Endodontic Journal by an Indian group titled as Survival Evaluation of Surgical Extrusion for the Management of Complicated Crown Root Fractured Maxillary Incisors. It was published last year in September 2024. Complicated crown root fractures that extend below the CG are challenging because they violate the biological width and leave insufficient ferrule. We have conventional options such as crown lengthening or orthodontic extrusion, but they have limitations such as bone loss, long treatment time, and some aesthetic concerns. Therefore, surgical extrusion can offer immediate supragingival tooth structure while preserving the papilla and bone. This procedure can allow us to gain immediate ferrule, shorter treatment duration, and preserve the papilla and bone. However, there are some concerns regarding the ankylosis, root resorption, and bone loss. This was investigated in a prospective clinical trial in a single center that was conducted between 2019 up to 2023, with the objectives of evaluating the survival and success of surgically extruded maxillary incisors with complicated crown-to-root fractures, and a third objective to identify predictors of favorable outcomes. The study included a total of 46 teeth in 41 patients with follow-up periods scheduled at 6, 12, 18, 24, and 36 months with a mean of 2.8 years. They all had complicated crown-to-root fractures with subgingival extension and more than 75% loss of the coronal structure. All cases had favorable baseline crown-to-root ratio. They excluded periodontal disease, systemic contraindications, teeth with open APCs, existing resorption, and curved roots. The minimum follow-up was 1 year, and the mean follow-up was almost 3 years. For the materials and methods, they standardized the photos and radiographs preoperatively and measures the feral height, the crown-to-root ratio, assessed mobility, margin and bone loss, periodontal depth, and the papilla height. And the endodontic treatment was performed before the extrusion in all cases. For the surgical extrusion, they did an atraumatic luxation using a thin periosteal 9 elevator to prevent surgical trauma. They did coronary positioning until 35 to 40% of the root was visible supragingivally. They splinted the teeth with a semi-rigid fiber splint for 2 weeks, and they had a mean extrusion amount of 2 to 3 millimeters. For the coronal restoration, all teeth received incremental composite buildups. For the outcome measures that were survival, which defined as the tooth retained regardless of minor symptoms, and the case was considered as successful if there was no pain, no physiological mobility, periodontal depths that are less than 4 millimeters, no progressive resorption, and less than 25% bone loss, and normal PDL. For the results, 44 out of the 46 teeth survived up till the time period of 4.5 years. That presented in 95% survival rate and a success rate of 89%. For the periodontal and radiographic findings, the feral height was increased from 1.5 millimeter to almost 4 millimeters. Favorable crown-to-root ratio was observed in most cases. 5 teeth only developed unfavorable crown-to-root ratio over the extrusion, and 2 teeth, which accounts for 4% of the sample size, had root resorption with non-progressive resorption. No case had any signs of ankylosis, and 6 teeth had less than 25% margin of bone loss, and the papilla was stable in 78% of the teeth. For the failures, 2 teeth failed due to secondary trauma, which was avulsion, and the identified predictors in this study was the favorable crown-to-root ratio. It was the strongest predictor. To conclude, surgical extrusion can be considered as a predictable and a conservative option for deep crown to root fractures with insufficient ferrule, with a high survival of 95% and low complication rates when performed with an atraumatic technique and a favorable preoperative crown to root ratio. Biological complications such as resorption, ankylosis, and periodontal breakdown were extremely low, of only 4%, and most failures were restorative, not biological. This represents a cost effective, aesthetic preserving alternative to implant or crown lengthening. Limitations of this study include the inability to determine whether the resorption originated from the trauma itself or from the extrusion procedure. It was single centered, which limits the generalizability, and it had a relatively short follow up duration of a mean of 3 years, which limits the long term prediction. And only incisions were included in the study where the results cannot be extrapolated to other types. The take home message from the study is that surgical extrusion, if done atraumatically with preoperative root canal treatment and an attention to the crown to root ratio, can offer a high medium term solution for otherwise non restorable anterior teeth with deep crown to root fractures. Thank you so much for listening. Hope you have a wonderful day. Bye.